our daily life, you may have a headache, you may have cramps or period pain, stomach ache, have a cold, have a cough, or you may have diarrhea and other symptoms. So these are the symptoms. You have to use the drugs for cure and get better. So these reasons why I want to show you how it is produced and how it is concerned with the statistical, cause is an important factor to us for cure disease so we can live longer. So the next one I would like to tell you the phase 1 to phase 4 for detail. So the phase 1 is checking for the safety and the best dose that is appropriate to the human. And so this phase use statistical data by random some healthy volunteers here and form all of the people, and that is called example group. And then the data this one, they will use this one for analyze, and then they will refer to the bigger group of the data. So the second, they will to know that it's also safe and how much of the drugs response. So they will also use the constant, but they will test with the bigger groups, and there are about 100 to 300 people that they will test. But this phase they will test with the affected people or the patients. And the statistical that concern with this phase is also like the phase 1 is, they will random some the patients or form or of the patient people, and that is called the example group, and they will refer to the bigger group of the data. So the next phase is the phase 3. So the researcher want to know that it's safe or does it work and confirm the results. And this phase they compare the effects of two treatments, and they will test in a larger group of the patients to show the safety and efficiency of the treatment. And this is the another treatment, that is the treatment B, and with a current treatment, that is the treatment A, and this is the amount of the people that they test. And so this trial concern the statistical, that is they will use the trial is called RCT, or stand for randomized control trial. And this concerns statistical, that is they have the control group, or in the science they will call placebo. And another is the independent variable, that is the treatment A, and treatment B is the independent variable. And they also have the control variable, or that's the treatment B or the control group. And this is also concerned bias, that is in the treatment they will use the same qualification of the treatment A and treatment B, that is the qualification of the people or of the patient that they for testing. And so if the same qualification, so it can reduce the occurrence of the bias. So the last phase is the phase 4. They will random 5 to 10,000 of the people to ensure that this trial is safety and efficiency. And then the drug is approved by FDA and then they carry out to the real life patients. They aim to find out how well the treatment when it's used more widely, the long-term risk and benefit, and more about the possible rare side effects. And this phase also concerns the statistical, that is, they random the example group and referred to the ratio group. So, according to all of the phases, all concern statistical using because the statistic means the tools or technical for analyze data. We call statistical method that consist of 4 steps. There are collection, presentation, analysis, and interpretation. Because every phase, the researcher will make a note or collection and they may be observe the data or observe the results. All of the contents I present to you is just for an instance of producing the drug because there are many methods of producing drug and using many statistical methods used in experiments and researching. And for an instance that I showed to you, they almost use the inferential statistical, such as they use an example group or the control group and independent variable, and this is the inferential statistic. But they may be used descriptive statistical after they carry out the drugs to the real life patients. This is the example. They use the graph and they use the drug in the patient. They use the persons and they compare for 2 types. And another case, this one, they use the drug in the patient too and they separate the symptoms, such as this one is stand for the better and the white one they stand for same and the black one is they stand for worse. And this is the amount of the patient, and this graph they observe in the symptom of the patients, and they also have the group that is the control group or placebo, and this one a current treatment. And this is an example that I want to show you. They use the descriptive statistic. So statistics very influence every part of the society. If there are more and more people, and it will be complicated, and then it needs to use the statistic methods for analyze, classify, and authors. And I think the society live without the statistic methods is maybe occur a trouble or disorder, because the statistic is a good way to organize and make everything easier. Thank you.